Hi there, Kendra Tolbert here. I'm a registered dietitian and yoga teacher, and I specialize in women's health and fertility. I'm quite delighted to share this interview with you. I just interviewed two fertility acupuncturists, Emily and Ghoncheh, the owners of Aphrodite Fertility in San Diego. In this interview, they shared so much information about how Chinese medicine works and how it can support people who are either actively trying to conceive, who are preparing to start trying to conceive in the future, and even people who have experienced pregnancy loss. This interview is jam packed with so much information. So, if you've ever been curious about how Chinese medicine can support you on your fertility journey, you're going to love this interview. Let's get right into it. Hi, Emily. Hi, Ghoncheh. Thank you so much for joining me today. I'm beyond excited to have you here and to have everyone meet you. So, let's dive right in. Introduce yourselves and let us know who you are and what you do.
Great to be with speaking with you, Kendra. Thanks for having us. So my name is Ghoncheh, and together this is Emily. We are Aphrodite Fertility. So we're a fertility education brand and acupuncture studio here in San Diego. And so our entire goal is to really bring women out of the darkness of infertility and to help them reach their dreams of bringing home their healthy, happy baby. And we do that through very much an integrative lens. So we're trained acupuncturists. We specialize in fertility acupuncture. We also help working with patients who are maybe undergoing fertility treatment, whether that's IUI or IVF, and to really help bridge the gap and get them to their goal of their healthy baby.
Yeah. Yes. And my name's Emily Marson, and together we make up Aphrodite, like Ghoncheh said, and we are actually just expanding as well. I just want to throw that in there that we've added not only acupuncture and TCM and integrative fertility care, but also now how we found you is we're adding a fitness studio that will have yoga and Pilates that is centered towards women who may be going through their fertility journey or their perinatal, prenatal, and postpartum, or even just hormonal regulation. So the classes will be designed around those intentions and just bringing women up and helping them feel their best.
Oh, I love that. And I love that you're integrating so many different things together to support people because often it does take a lot of tools to build something, like in general, right? In life, you can't build everything with a hammer. Sometimes you need, I don't know other tools, but you need other tools besides a hammer. So I love that you're making all of those tools available under one roof. Amazing. I'm excited. There was a term that you use that I think can get thrown around a bit in kind of the fertility wellness space. And so I want to make sure that everything is well defined before we move forward. So you said acupuncture and you said TCM. So TCM is traditional Chinese medicine. I'd love it if you could tell us exactly what traditional Chinese medicine is and explain how it's more than just acupuncture.
Yeah, so traditional Chinese medicine encompasses a wide variety of tools. So acupuncture is one of them and probably the best known. It also includes herbal medicine. So there are set and defined group of herbs and formulas that the Chinese have used for 1,000 years to treat certain conditions and symptoms that come up um, in the patient who comes in front of us. And then there's nutrition advice as well. There's a thing called moxibustion, which is a burning of an herb instead of an herbal medicine, which is ingesting of the herb, which is super powerful and honestly magical, if I'm going to use the word. In the Western sense, what it does is it brings down inflammation, and in the sort of Western world, there is a lot of chronic inflammation that's not quite well defined by or well diagnosed by Western medicine. And so moxibustion is part of this cohort of tools that we have in our tool bag as traditional Chinese medicine practitioners. And then we do some traditional massage as well called Tui Na. And in addition to that, there's some energy work called qigong, and some people may have heard of tai chi. It's a sort of a sidestep from tai chi. So there's a whole wealth of new tools that a lot of um, the Western world doesn't really know well, and so we bring that to the table, as well as our knowledge of Western fertility diagnoses and tools, and we merge them because we think like the best care is that is integrative, because we're all looking at the same body, right? We all want that body to be well and function well. So there shouldn't really be clashing. It should be, here's all the tools. Let's define what's going on and work together to bring this woman in our case into full fertility and full health.
I love that. I love that you two definitely have like a wealth of knowledge in both worlds, and you see so clearly how they can actually enhance each other, and that it doesn't have to be one or the other. It's
Right.
really just what's best, what is the best thing to serve the person in front of you. And I
Exactly.
love
I want to sort of speak to that because something that we do often, when a patient comes into us, um, sometimes what can show up is like low thyroid, hypothyroidism for fertility cases. And um, the goal we have to keep in mind is always to get the patient to their healthy, happy baby as fast as we can. Like that, they're in such distress. And so the goal, we have to keep the goal in mind. And so could we use traditional Chinese medicine and herbal medicine to bring the thyroid function up? Yes. Does it take longer than it takes for someone to take some synthroid or levothyroxine and then get them to their healthy baby? It does, because it's natural cumulative medicine. And so it's very different for a patient who comes in for fertility who wants to be pregnant now versus someone who's just coming in for wellness and wants to regulate their thyroid. What we'll do for someone who has hypothyroidism, like obvious clinically diagnosed hypothyroidism, is say, we suggest you talk to your doctor about getting on a little medication, because that in itself could be the thing that ticks the needle,
Yeah, totally.
that sort of moves the needle is the word.
Yeah.
And the goal, we have to keep in mind, the goal is the healthy, happy baby, not our sort of like what's the word?
Like our preconceived notions about
Yeah,
how it should be done.
like
Yeah.
traditional Chinese medicine is sort of above Western medicine. Like there's whatever works is what we suggest. There's no competition. Does that make sense?
It does. Yes. It absolutely makes sense. And I'm
Yeah.
so happy that you said it, because I definitely think there can be a feeling of, I don't want to put words in people's mouths, but I've definitely had clients that have come to me and it's almost seems as if they feel like they've failed
Totally.
if they can't just do it with like nutrition and exercise. And
Right.
that's not a failure to make use of everything that's available to you to support you in reaching your goal. So
Totally.
thank you.
Exactly.
Yeah, I mean, we really see it all as like tools in our toolkit, kind of like what you said earlier about the hammer. A hammer can't fix every problem. It's like, well, what's in our toolkit? What do we want to use? Let's take this, maybe try it. That didn't work. Let's try something else. And it helps to like take away some of like the emotional charge around like what it means if you need an extra support. Because we just remember that it's like a tool and tools are here to help us.
Yeah.
There is no shame in using whatever is available to you. None
Exactly.
at
Yeah.
all. You mentioned the word diagnosis, and I feel like this is something that I really kind of struggled with and still struggle with as I learn a little bit more about Chinese medicine, is how different the diagnosis is compared to what you might receive from a Western provider. So, can you tell us a little bit about how a diagnosis is made and how that differs from how a diagnosis is made in Western medicine?
You want to take it? Yeah, sure. Well, we can tag team.
Yeah.
We'll tag team it. So in Chinese medicine, we look at the body as a whole. All the systems are connected, and they all play into one another. And even though, according to Western medicine, it may seem completely like unrelated. So in like the Western medicine paradigm, you'll go to like an eye doctor, and then you'll go to like a dermatologist, and then you'll go to like a heart doctor, and you're getting all these different cares. Nobody's talking to each other. But when you come to see a licensed acupuncturist, we're looking at all the systems, and that kind of helps us that tells us what the bigger picture is of going on. So instead of zooming in on one thing and maybe throwing something at one particular symptom, we're looking at really the whole picture. So as far as diagnosis, we have internal organs. So Chinese medicine understands the body from the point of view of our internal organs. All the organs have a particular function and work together. They should work together in harmony. So when there's an imbalance in any of the organs or the function of the organs, whether there's too much of something, what we call excess, or there's not enough of something, what we call like deficiency, then there can be disharmony or symptoms that can then lead to a diagnosis. So there's this phrase in Chinese medicine that says like what is it? One pattern, many diseases, one pattern. So in Chinese medicine, we look at what's called a pattern, which is a pattern of your symptoms that paint a picture, and that pattern can coincide with many different Western medicine diseases, or you can have many diseases that coincide with just one pattern.
So like, for example, a patient comes in and they have a diagnosis from their Western medical practitioner, their doctor, like PCOS. And we don't choose points for PCOS. We choose points for the set of symptoms that the patient says that they're having, which may be different from someone else who comes in with PCOS and they're having other symptoms. And so we're treating the patient in front of us instead of the diagnosis that's labeled on them. Okay. And so that's sort of how diagnosis shifts. It's very between Western and Eastern. Our medicine is very curated to who's in front of us and not pointing at treatment to the particular diagnosis in the book. That makes sense?
It does. It does. The way someone explained it to me once was the idea of you can have a cough and you can just, suck on a cough drop, but that doesn't tell you where that cough is coming from, right? Like it may be because someone's smoking around you, in which case you would need to address the fact that someone's smoking around you. It may be because your throat is dry, in which case you would need to drink some water. Or maybe it's because you have allergies. And so, that postnasal drip. And so how you would actually get to the root of that cough would be different than just taking a cough drop. Am I getting it right?
Yeah,
Exactly.
Yeah. And I can go, why don't I, this is probably a good point to sort of go into the basic theory of Chinese medicine, which I've spoken about on other sort of interviews, but I like to sort of get this digestible version out, because when people talk about Eastern medicine, they talk about qi and it's like, woo, what does that mean? So when you rub your hands together, it creates a heat. Okay, so movement creates heat. That's something that everyone can get behind. When you run, you sweat. Okay, and so your organs move. So your heart pumps and your kidneys filter and your lungs expand. And so there is heat coming off of the movement of your organs. And this heat is what we call qi. Okay, so this heat is energy. Heat is energy in general. Like when you turn on a burner on a stove, it can boil water. Okay, so heat is energy. Your organs give off heat. And just like your nerves and your blood vessels, this heat comes off of your organs and runs in certain patterns in your body. So the heart heat comes off of your heart and runs down the inner aspect of your arm. And this you may have seen in the Eastern medical traditional posters. Those are the channels of qi, the channels of heat. And so when the heart itself or its heat pathway becomes either deficient or in excess, like inflamed or stagnated, then there are a certain set of symptoms that present. So, for example, in Chinese medicine, if the heart heat is in excess, there can be anxiety. You think heat rising to the head off of the heart, right? And then there's the mind going. There can be insomnia because there's, again, excess heat rising off of the heart and goes to the head at night when you should be nice and cool. And so what the needles do in acupuncture and herbal medicine do is they address the organ's heat pathway, and they go in along the points along the pathway to and elicit a response from the body. And so just like any foreign body entering the body, like a bee sting, even though it doesn't feel like a bee sting, the body basically sends blood and lymph there. On a lot of patients, there will be a little bit of like a histamine reaction. You'll see a little bit of redness. And that means that the blood and the chi and the lymph are going to that deficiency and filling it up, or that stagnation and it's pulling it and it's pushing it through, or bringing down an inflammation. And then that organ's heat pathway can resume optimal health, and you'll see those symptoms come down. So that is sort of the philosophy, the Western version of the philosophy behind traditional Chinese medicine.
Ah, no, that all makes tons of sense. And it definitely points to the fact that we are getting, I guess I would say, like a new language in a way, like a
Totally.
language to express something that has long been understood in another culture and another lens. And now we're having the words to explain it in a Western sense. And so I am seeing more reproductive endocrinologists recommend that their patients go visit acupuncturists. I'm assuming that that's because there's research that's encouraging people to explore it. So, can you talk a little bit about any of the research that you've read or come across that is saying, hey, this is something that we should be exploring more for people who are trying to conceive?
Yeah, I can take that one. Yes. So a lot of well, first of all, what's really cool about studying acupuncture is that in a clinical research setting is that they've done functional MRIs, and there's let's say a point on the leg that in traditional Chinese medicine says that let's say it brightens the eyes. Okay. And so they'll put the point in the leg, and they'll have a functional MRI, and they'll see the portion of the brain that is involved in eyes light up. So while Western medicine can't explain like why that is, where the connection comes from, they can see that it is working, right? Um, and so the difficulty with Western research around acupuncture is that the best research is done under a double-blind study, okay? The most well-respected research. And it's hard to give someone acupuncture without giving them acupuncture. Like, how do you do that blindly? Right? So the good thing is that while they can't do a double-blind test, what they can do is see that it works. They can't figure out how the connection is, but they can see the results are statistically significant. And they can do that a lot of time for fertility under the controls of IVF. Because in the IVF setting, the hormone system, so the speaking from the pituitary gland to the ovaries, is sort of suppressed. It is suppressed. And so then in IVF, they control for exogenous hormones. So they decide the dosing of the hormones that come into the body. And so that there's not any internal influence of hormone regulation. And so what they can do is see that acupuncture can increase pregnancy outcomes in a controlled setting. Does that make sense? And so there has been a lot of research between on-site acupuncture at transfer and increased blastocyst formation. This is very technical, but in the IVF space, because of the controls. And what's really cool is that fertility doctors and IVF clinics have to publish their success rates. It's public information. And so while a PCP may be hesitant to recommend acupuncture because they don't really get how it works, a fertility doctor is very eager to recommend acupuncture because they can see that it increases their success rates. And what matters to them, because they have to publish their success rates, are their success rates. So we get maybe 60% of our patients are recommended from IVF clinics here in San Diego, because the fertility doctors know that it works. They don't know how it works, but they're like, hey, we want success. Obviously, everyone does for their patient. Go see this acupuncturist over here, and we can together get you to a higher chance of getting you to a healthy pregnancy.
Okay. No, that definitely helps me understand exactly why it is that providers are starting to make this recommendation more and more and more. As you were talking, this question came to mind, and it feels a little bit more philosophical, or maybe just something I'm working through myself. So if you don't have an answer, no worries. I am constantly trying to find the balance between, maybe, do I talk to my therapist about this? We'll see. Find the balance between respecting traditional wisdom and respecting that it doesn't need to be backed by science to be valid.
Right.
And the scientific evidence influences and encourages people who that is what they need in order to feel comfortable exploring something new. It helps them feel safe in trying something new. How do you two balance respecting what has long been known and accepted, and I guess being okay with, I don't know if there's a right term for this, being okay with the fact that some people need scientific evidence in order to believe something is true?
I'll take a stab at it. Yeah, that's such a cool question.
Yeah.
I think it really just depends on who's in front of us. Most of the patients who walk through our door are just very like type A. They just like knowing things in a very kind of like technical form. And some people really love knowing what the research is, and other people just want to be like, talk to me about Chinese medicine, like talk to me about how acupuncture actually works. So it really just depends on who's in front of us. The really cool thing though, is that you don't have to believe in acupuncture. Like acupuncture is not like something you have to believe in for it to work. It's gonna work no matter what, even if you are very skeptical. So we
so it works. The reason it's not placebo, like believing it works so it works, is because they do it on animals. And so animals don't have a conscious understanding of what's happening to them. But an animal that walks in with hip pain and gets acupuncture and leaves jumping around, there was no placebo effect. So you, again, like speaking to what Ghoncheh said, is you don't have to believe it for it to work.
Yeah. So I think it's a natural kind of evolution in kind of our modern day and age of like practicing this like incredible ancestral body of wisdom with the utmost reverence and respect and gratitude that we get to practice this medicine, and then also kind of like adapting our practice of it in a way where people are very information driven. Everybody's coming in, they're highly educated. Everybody's Googling stuff and they come in and they have questions, they've done their research. So it's, it's helpful for us to be kind of backed by the scientific body of research to help to explain to people and kind of give them ease. And also a lot of people who are coming in are healthcare providers as well, nurses and doctors. So it's really helpful for them to hear about the vast body of research that shows that acupuncture is really helpful for increasing pregnancy.
Yeah. And I'd also say, sometimes the research needs to catch up to the clinical results. In Western and any research, right? Like there has to be enough research done on a large amount of people for it to really coincide statistically with what you're seeing in the clinics happen. And so it may just be that because acupuncture is just starting to be studied in a clinical, in a research setting, that they haven't caught up with what we're seeing in the clinic. Does that make sense?
And it also takes like so much funding to even have research to explain what we've been seeing, what you know, the Chinese have been observing for thousands of years, and clinically what we've been seeing for years and decades. It takes decades for that research to, you know, even get funded and then published and then be publicly accessible. So there's definitely a lag time.
Yeah. And I mean, we'll just keep going.
Yeah.
And also, like, you know, there's intuition around you can lean into the fact that it's been around for 1,000 years, right? And if it didn't help people feel better, you know, it wouldn't have survived so many decades, hundreds of years. So you can, even if we don't know how to explain it, you don't know why you feel better when you leave, you can lean into the fact that you're of this huge body of people that it's helped.
Absolutely. Yeah. I mean, that definitely is evidence, right? There's lots of different forms of evidence. So thank you for going with me on that ride and being
There's
willing
a lot to say about that.
to answer like my existential crisis of a question. So thank you. You actually touched on something a little bit earlier. You talked about people coming in for general well-being and maybe not feeling as under the gun or under like a time crunch to get things done as quickly as possible. And so I'd love to hear about what it might look like for someone to come in when they're preparing to start trying to conceive rather than someone who's actively trying to conceive.
Yeah, we really love reaching people in the preconception phase, where they know that, you know, maybe or maybe not they're getting married in the next 6 months, and they know that shortly after that they're gonna get ready to start trying. That allows us to do some like deep kind of healing and fortifying and replenishing without the pressure of tracking and testing and worry. So it's what was your question? What's it look like for people in preconception? Yeah, so we like to offer up kind of just like the tools and the general recommendations, and I really love to offer patients like kind of like choose your own adventure in terms of how invested do you want to be really early on. Some people know that they just want to come in for like general kind of tune-ups and like well-being, and maybe aren't quite ready to do all their labs and all their kind of hormone testings that we ask patients to do, those patients that are actively trying. So, and then as they kind of get closer to when they're ideally would start trying, then we bring in more and more tools, because in the initial visit, we can really throw a lot at patients. We have so many things available to help people.
Yeah.
And so it can be a lot. And so for people who are in the preconception phase, it's kind of like a slow ramping up process. And I think people really do well with that.
And I think that everyone can benefit from like a downregulation of their nervous system. And so that's really the most immediate thing that you'll notice after your acupuncture treatment, is that you just feel better, like because your fight or flight response has been downregulated. And that's an immediate response. I like to bring into the fact that a patient was wearing her aura ring, where you can actually see the graphs of like your deep sleep states. And she showed me that during her acupuncture sessions, like her graph of her deep sleep state went like the lowest it does ever. Like even in her night sleep, she doesn't get as low. And that just sort of is a visual picture to what's happening when you're on the table and your fight or flight, it gets to come offline, and everyone can benefit from that. And so even if that's the beginning of your treatment with us, you're going to feel a shift like immediately. So that's the foundation to anyone coming in for acupuncture.
Yeah, that was definitely my experience. I saw an acupuncturist for the first time maybe 2 years ago. A childhood friend had died unexpectedly, and I was really struggling with grief. And I had seen a therapist, and it was definitely making a difference. But I'm very like somatic, and I was like, ooh, I want something that feels body based. And so I went to see an acupuncturist, and it made such a huge difference. I think in part because I was speaking to someone who deeply cared about every aspect of me, but also because like it was relaxing, very, very relaxing. Yeah.
Yeah. And that's part of the treatment is to be heard, right? And to have someone who empathizes with you and really hears what you're going through and understands that it is a somatic. It can have a somatic response. Like your feelings will show up in your body, right? And not be dismissed that those two things are connected, right? That you might get from like a Western medical practitioner.
Yeah, I hear that a lot. Like a patient will say that they'll name like a few symptoms or like lack of symptoms, and they're like, "Oh, I'm probably like just imagining that." Like, and I'm like, "No, you're not imagining that. That is so real." So really, like,
So
pay
real.
attention to that. Like, give credit to that because it really says a lot. And I think in our modern day and age, we're very like disconnected from like our intuition. So we really just try to like bring it back. Like if you in your body have noticed a shift, that shift has happened, it's real, like, let's celebrate it.
Yeah.
Mhm. Now, I didn't originally plan to ask you this, but since I went there, is pregnancy loss something that you all help people through?
Yes, absolutely. We are here to help with grief, however that is presenting, either pregnancy loss or grief in isolation that you're having to deal with something on your own because it's still really taboo to talk about infertility and miscarriage and um I again sort of like fundamentally what we bring to that is someone to sit with you in that grief and recognize that it's okay to have that your body is healing in grief as well and not to push you through it if you're not ready, right? And just sort of hold you where you are in that grief, but also present um, energetically healing, if like coming from us. And then also like the physicality of the needles can help move grief. Interestingly, each organ sort of holds a emotion, and grief is, in Chinese medicine, and grief is the lungs are the container of grief, and so oftentimes we'll see that when you're having grief, you get a cough, and you get like a chronic cough, and so we can energetically build up a deficiency and help the organ itself return to health, which then helps the emotional stagnation that people feel with grief. But to answer your question, yes, we are here for the whole spectrum of fertility care, and a lot of that is at the emotional level.
Yeah, absolutely. I love that. I love to hear that you're there for the entire journey. And there's so many aspects, right? Like someone can come to you before they're even actively trying to conceive. Someone can come to you while they're actively trying to conceive. Maybe they haven't, made it to 6 months or a year, but they know that, hey, I could use a little bit of support. Someone could be experiencing difficulty with the journey, and someone could have experienced a pregnancy loss, and you're there for all of it. So that is
Yeah,
lovely to know.
Yeah, we think like so much of the medicine is not just like the acupuncture and whatever therapies we're using, whatever modalities, but it's like the interpersonal connection, the not being alone, like Emily's talking about, just like the being heard, the space to feel it all. And then whenever they're ready, a path forward too.
yeah,
And we're here for all of that, especially with just like really kind of like complex cases of like recurrent losses. Like we have a path forward and we'll talk you through it,
yeah,
like if and whenever you're ready.
yeah.
Thank you for that. Thank you. Now, not everyone who watches the channel, even though it's called Live Fertile, is actually trying to conceive. Some people have this lovely idea that I'd like to believe I planted maybe a tiny seed for them, that fertility is about so much more than just the ability to conceive, right? It's their overall health that kind of shows up in their fertility. So, what are some ways, or maybe what are some conditions besides infertility that you all help people through?
Oh, everything. The main one and the biggest that acupuncture is really known for, and that has like the widest body of research on it, is treatment for chronic pain. Really any type of pain in the body, chronic, acute, any body area, any joint, muscle group. Acupuncture is really incredible at treating pain in a way that really no other therapy can. And
Yeah.
um,
It's fast. It's a fast response.
Yeah.
It doesn't take a lot of treatments to get you out of pain.
Yeah, and it's easy to treat for that very reason. So pain is a really big one, and really reducing inflammation. And inflammation can show up in so many different ways, kind of systemically. And there's a lot of research that shows that acupuncture brings down that kind of inflammation, kind of red hot response. Whether that's something that's like seen physically or kind of in the deeper levels. Really great for headaches. So for people who suffer like chronic headaches and migraines and are coming in and they're like, I have 10 migraine days a month. And then we bring them down to maybe like 1 or 2, and they're not even that bad. So we really shine there. Also like emotional regulation, people coming in with like anxiety and depression, and we can really help to ease off some of the weight of those emotional states. So
Yeah, I'd say where Eastern medicine really shines is in the sort of chronic conditions. So Western medicine is so good. You break your leg, you're not coming to an acupuncturist. Like you're going to the acute, hospital. But in those conditions that the doctor's like, we don't know, like here's a pill for the rest of your life. That's where we can move the needle. We can get you out of something that you may have thought you would have to deal with the rest of your life. That's where Eastern medicine really shines, is in the chronic conditions.
Thank you for answering that. We actually have one more question, and this comes from someone in the community. And they wanted to know, actually, let me scroll down to it. They wanted to know what time of month is best to begin acupuncture for fertility, slash, when should someone start acupuncture to support their fertility? They're kind of two separate questions, but they might mingle together.
yeah, so the amazing thing is like start now. Start now. There's no right time in your cycle.
Yeah.
You can be on your period, you can just have ovulated, you could be close to getting your period, or maybe even potentially pregnant. Start now. We know all the right questions to ask to figure out kind of what areas we're focusing on. And it's never too late to start acupuncture. I think a lot of people they're like, I've missed my boat, I should have done this a long time ago, it's not going to help me. Like, just start now. And we can treat you wherever you are in your cycle.
Yeah. It's interesting, like the cycle, there's the 4 main hormones of the cycle, and they almost correlate to the 4-ish weeks. And so once we know what cycle day you're on, we know how to treat you. So if you're interested, just come in and we'll do an initial consultation, which usually lasts about an hour and a half, where we really dig deep into your history. But in that, we'll sort of understand where you are in your hormonal regulation of your cycle, and we'll know how to treat accordingly. So I'd say, to reiterate, just come in, get yourself started, because we can really help.
Yeah. So if you're in San Diego, one, I'm jealous, but also make sure that you go visit Aphrodite Fertility, because like clearly y'all can see it. They're amazing practitioners. So again, if you're in San Diego or you can get down to San Diego, definitely stop by and get taken care of. Where else might people learn more about what you do besides this video, and learn more about what it looks like to work with you?
Yeah, well, we have virtual appointments. So if you're not in San Diego, you're welcome to book through our website for a virtual consultation, and you'll get great care through that setup. And then we also have a blog, which again, we're an education heavy brand, so our blog has so much information. And so check that out. We also, our Instagram is education heavy as well.
At Aphrodite Fertility.
At Aphrodite Fertility. We're on all the socials, so the TikTok, the YouTube, the Pinterest. We're on all of those, so check those out. And
we also want to announce we just moved into an incredible, huge new space in just central San Diego in the Bankers Hill neighborhood. So there's, we're bringing, did we talk about this in the beginning? Bringing on another acupuncturist, bringing on an incredible perinatal massage therapist. So we're really growing, and we really have the space to treat you all. So come on in and come check out our new studio. We'd love to have you.
And it's really just our mission to help as many women as we can. That is the clear defining point, that we just want to reach and help women in the darkness of infertility. Please come. We can help you. We can help you, and we can hear you too.
You're definitely doing it. Thank you for shining a light on these important topics and for sharing all of your wisdom with us. I will make sure to link to everything in the description box below. Make sure that you head down there so that you can connect with these two lovely humans. Thank you again.
It was lovely.
Thank you so much
for having us.
This was a blast.